Welcome you back to Introduction to Health lecture. Today, our focus here is on some disease trend. Then we'll have to define non-communicable chronic disease, the four main groups of NCDs and disease trends, poverty and chronic disease, comparative trends, Cameroon versus USA. Then we have our conclusion. Some disease trend we see. Trend in non-communicable disease. What's a non-communicable disease? What's a chronic disease? Non-communicable disease is a disease which is not contagious. Risk factors such as person's lifestyle, genetics, or environment are known to increase the likelihood of certain non-communicable diseases. Chronic disease is a disease that is long-lasting, at least 3 months, or recurrent. A chronic cause is distinguished from a recurrent cause. Recurrent disease relapse repeatedly with periods of remission in between. Four main groups of non-communicable disease we have: cardiovascular disease, diabetes, chronic respiratory disease, cancers. Mortality rate among men and women aged 15 to 59 years, region and cause of death group as shown in the chart below. Cardiovascular disease, that's the first non-communicable disease we're looking at. The world's #1 killer, this cardiovascular disease. Non-communicable diseases are responsible for 60% of death worldwide. That's 3.5 million of these can be attributed to cardiovascular disease. Heart attack, stroke, we have disease like that. World Health Organization estimates that global deaths for non-communicable disease will continue to rise over the next 10 years, with the African region expected to see the highest relative increase. We can see death attributable to diabetes and percentage of all deaths in the different countries. Cancer deaths attributed in infection. Chronic disease, cardiovascular disease, mainly heart disease, stroke, cancer, chronic respiratory disease, and diabetes. Poverty and chronic disease. 80% of chronic disease deaths occur in low and middle income countries, where most of the world's population lives. Chronic disease and poverty are locked together in a vicious circle. Chronic disease hinders economic development and worsens poverty. The poor are also more vulnerable, having more exposure to risks and less access to health services. For example, in rich countries, some 50% of cancer patients die of the disease, while in developing countries, 80% of cancer victims already have late-stage incurable tumors when they are diagnosed, pointing to the need for much better detection programs. Did you know that 35 million people died from chronic disease in 2005? 60% of all deaths are due to chronic disease. The economic impact in billions. And risks and increase. in the various countries all over the world. Face to face with chronic disease, we have obesity. And face to face with chronic disease, cancer. Comparing the USA and Cameroon. Population percent of growth development program on health, per capita health spend, GDP in billion, children, women, gross national income per capita, percentage population living on under PPP, $1 daily. Conclusion: the concept of health is linked with other issues that work in synergy to make it relevant. In this context, aspects related to healthcare services, community engagement, as well as allied issues of concern such as nutrition and policy have to be considered in order to paint a better picture for the development worker. Thank you very much for watching. God bless you. See you.